Hi, my name is Sara Kyllo, and this is my health education program for Nursing 444 Community Health. I am an Indiana State University LPN to BSN student, and my project is on what is tetanus and who is at risk. Take a look. Click the link Pre-Test and Post-Test under the description on YouTube to test your knowledge before and after the presentation. Informational Packet. Click the link Information Packet under description on YouTube for a printable packet with information from this presentation. What will you learn from this presentation? Below are the learning objectives. Viewers will be able to define what tetanus is. Viewers will be able to describe who is at risk for developing tetanus. Viewers will be able to list the signs and symptoms of tetanus. Viewers will be able to list the treatments for tetanus. Viewers will be able to define ways to prevent tetanus. Viewers will be able to describe ways nurses formulate lifelong planning for nursing practice in relation to tetanus and overall community health. Viewers will be able to describe how nurses investigate the impact of financial and regulatory healthcare policies within a community. What is tetanus? The CDC states tetanus comes from the bacteria called Clostridium tetani. Bacteria from tetanus live in the soil, dust, manure, on rusty fences and nails, and other places within the environment. When the tetanus spores make their way into the body, this is when bacteria begins to form and release the toxin, tetanospasm, and impedes the control of our muscles. The ways bacteria from tetanus get into the body are open wounds, surgical sites, dental infections, IV drug sites, insect bites. These are just a few ways that tetanus can get into the body. Who is at risk for developing tetanus? The CDC reports people at risk for developing tetanus are ones who have not had the tetanus vaccine or ones who do not get the recommended 10-year booster shot. Anywhere from 200 to 300 cases of tetanus are reported every year. What are the signs and symptoms for tetanus? The signs and symptoms of tetanus can occur anywhere from 1 to 3 days to many weeks after the bacteria has entered the body. Signs and symptoms include spasms and stiffness to the jaw, having a stiff neck, having a hard time swallowing, having a fever, having elevated blood pressure, having stiffness in the abdominal muscles, having painful body spasms that may occur for multiple minutes and are also triggered by noises and physical touch. Often people become sweaty and have a fast or irregular heartbeat. What are ways to treat and prevent tetanus? Treatments for tetanus include admission to the hospital, aggressive wound care, quick treatment with human tetanus immune globulin, also known as TIG, medications to reduce muscle spasm, and antibiotics to treat the infection. What are ways to prevent tetanus from developing? Those include getting the Tdap vaccination and booster shot every 10 years, and washing wounds or breaks in the skin diligently with soap and water or alcohol-based solution right away. Formulating lifelong practice and education for nursing practice. It is important for nurses to formulate lifelong practice and continuing education plans for nursing practice because nursing and healthcare is changing daily. And with a continued learning plan in place, nurses will build better relationships with patients, decrease patient deaths, improve patient care, and lessen the chance of nursing errors. Ways nurses can formulate lifelong practice and continued education for nursing practice include accept responsibility for one's own learning, see challenges as a way to grow and become wiser, have confidence in oneself, consider learning more than just learning, be a mentor and teach others, ask questions if confused or not understanding a certain concept, use your learning in the nursing practice and in your daily job, try and learn something new every day, and write down your goals. Continuing education. One can watch online nursing classes or learning classes, attend nursing conferences, joining nursing associations, engaging and completing on-the-job trainings available, researching and reading evidence-based practice journals and articles, and volunteering. The impact of financial and regulatory healthcare policies in a community setting. It is important to know what healthcare policies are set in place for communities and how they can make an impact in a negative or positive way. Healthcare policies, including regulatory and financial policies, have been implemented into communities as follows. The Health Quality Improvement Act of 1986. This act protects the community from incompetent medical professionals. Medicare. This program offers health insurance and paid medications to many Americans, more so for senior citizens. Medicaid. This program offers health insurance to many Americans for reasons such as being disabled and unemployed temporarily. Health Insurance Portability and Accountability Act of 1996. This act makes it so workers can bring their healthcare insurance from one job to another and not be penalized until they're able to get their current work's insurance. This also protects people from being denied by insurance companies for current health problems such as cancer. Patient Safety and Quality Improvement Act of 2005. This act helps healthcare workers report unsafe work conditions that they encounter. Affordable Care Act. This act states that all people must apply for health insurance. Companies who have 200 plus employees must offer health insurance to their employees. Child Health Insurance Program, also known as CHIP. This program allows for children to be covered by health insurance if a parent or guardian is not able to provide health insurance due to low income or not having a current job. Their child will be covered if an emergent situation happens and they need to seek medical treatment. Supplemental Nutrition Assistance Program, also known as SNAP. This program offers a money card to families who do not make enough money to purchase and provide food. Families must undergo a visit with a person at a site near them, fill out an application, and discuss how much money they're available to get a month. It's important for nurses to know these types of financial and regulatory healthcare policies so they can help their patients and clients within a community setting. Want to learn more information from this presentation? Visit the following websites for more information. You can visit the Centers for Disease Control for tetanus information, the Mayo Clinic for tetanus information, and you can also visit this website called Being a Nurse Means Pursuing Lifelong Learning. You can find a lot of ways here that nurses can improve their learning and bring it into their practice every day at work. Here are references to this presentation. Thank you again for watching, and please go back and take the post-test to see what you have learned from this presentation. Thank you!